Good afternoon, everyone. Talal Alzghari, Wild Cornell Medicine. I'm very excited to present our work using a novel double balloon platform. So I'm going to play the video with the narration. So this one. Yeah.
In the United States, colectomy for benign polyps is performed for more than 25,000 patients annually. Multiple challenges exist in removing polyps via the luminal route, such as polyp size and presence on fold, but also, in particular, the anatomical location, whether it's at the sigmoid or the cecum. The sigmoid presents unique challenges due to its untethered nature, difficulties in maintaining position, and the paradoxical movement that can exist in flexible endoscopic maneuvers. This can increase the difficulty of the procedure and increase the time of the procedure as well. Here, we postulated that the use of the Dilumen, which is a double balloon platform, will assist in optical visualization, diagnosis, and endoscopic procedures. The device is a double balloon platform, which can be added to any commercially available colonoscope. It has two independent inflatable balloons, one which can control the endoscope tip position, and the other which can be extended in front of the tip of the endoscope to a variable distance. The first step involves setting up the dilumen by lubricating its inner aspect. The lube is spread along the length of the sheath. This will ease the insertion of the colonoscope. The scope is slid into the dilumen with both balloons deflated. As we see here how the scope passes the two balloons, and this is the desired position of the colonoscope for proper insertion in the colon. After passing the desired location within the colon, a polyp for example, the colonoscope tip should be pulled back behind the foreballoon. The foreballoon can then be pushed in and the knob is tightened to prevent any backward movements of the foreballoon. Next, the balloons are partially inflated as indicated by the yellow color on the inflation handle. Pulling back the whole system will help to create stable and clear therapeutic zone after inflation of both balloons as indicated by the green color and the handle. Here, we present two cases of sigmoid large symptomatic polyps. Both patients were referred to colorectal surgery department for colectomy. The first case is a 61 years old female patient. The second case is a 41 years old male patient. Both patients presented with bleeding per rectum. In the first case, here you see the attempt to visualize the polyp using the colonoscope alone. As you see, it's difficult to visualize the base. Once the dilumen was added to the scope and passed beyond the lesion, then the full balloon was deployed and partially inflated. Then the device was withdrawn proximal to the polyp. That helped in straightening of the sigmoid colon. Now it's become more clear to visualize the polyp. As you see, the significant difference in visualization after adding the dilumen. After making a clear and stable therapeutic zone, endoloop and hot snare of the stroke is easier now as shown here. Few endoclips were applied to the defective area. Following this, the specimen can be captured and withdrawn from the patient using the sheath. With the help of the Dilumen, we were able to avoid the surgery and its complications with only simple polypectomy. In the second case, the polyp location at the curve made it really difficult to visualize using the colonoscope alone. Once the Dilumen was added and passed beyond the polyp, the pore balloon was deployed and partially inflated. Then the whole system was slowly withdrawn. Here you see, with the double balloon platform, we were able to straighten out and splint the sigmoid. Now we can see this large polyp easily. Fully inflating both balloons helped in creating a clear, stable therapeutic zone that made endoloop and snaring of the polyp easier. Then the specimen can be withdrawn through the sheath, and the scope can be reinserted to the desired area within seconds. Both patients were discharged in less than 24 hours, and their 1-month follow-up showed improvement with no new complaints. In summary, we presented 2 large sigmoid polyps that were difficult to see with the colonoscope alone. With the help of the Dilumen, both clinicians felt the procedure less challenging due to better visualization and more stable environment. In conclusion, we believe that the Dilumen platform seems promising in large polyp removal.
Well, thank you.